the healthcare jobs are. The Bureau of Labor Statistics estimates there will be more than 500,000 jobs created in nursing by the year 2018. Of course, going back to school isn't for everyone like it was for Tanique Burns, but the BLS also projects an explosion of new jobs for home health aides, personal care aides. Those have no medical experience or training really necessary, or minimal training. Andrew Rubin is VP of Clinical Affairs at NYU Langone Medical Center and the host of Sirius XM Doctor Radio. Andrew, it's critical, I say, to get a so-called ladder job if you're going to go into, go into nursing, do the 2 years of training to be an RN, I think, then you can move above with more training, more education, more degrees to get even higher paid jobs. Some of these jobs pay well into the hundreds of thousands of dollars. If you're on the lower end, though, sometimes there's not a lot of room for movement.
That's true, but as you say, not all jobs are created equal. So you have to kind of decide what your career ambitions are. A lot of people don't want to...
And your skills.
And your skills, and they don't want to interact with patients. But that doesn't mean there's not a lot of jobs out there.
Like what?
Well, there's,
insurance billing.
Insurance billing. There's a lot of jobs in insurance
calling
billing.
me about the insurance billing, calling me again about the insurance billing.
Medical coders, administrators like myself, my day job. There are lots of jobs, and depending on what you want to do, you just have to target your career after that.
I think most people would like to grow old and be healthy and live in a nursing home. We know there's a lot of jobs.
Especially the last part.
As we're
Sweet.
in fact, on his weekends he goes, he checks in just
totally.
for fun.
Well, you wouldn't believe the action in those
restful.
places. My mom's a nurse.
And the comedy, he gets the most of his comedy from the nursing home.
My mom's a nurse, and now for years has worked in home health administrative services for the state of Kentucky, and she had quote-unquote a ladder job in that area, but it took a very long time. She worked at a private doctor's office for years, and then there was a transition of having a hard time finding a nursing job for a while. So it's a secure job because it can't be outsourced.
Right. Although we are seeing in some urban areas, and you and I have talked about this before, you're seeing hospitals close. So I get emails from people who say, you keep talking about nursing and healthcare jobs, but they're closing the healthcare in our neighborhood. Overall, you're going to see an explosion of healthcare jobs. It might just not be where the hospital is just closed.
And mobility is key. So what happens in New York City may not be the case in Kentucky.
I want to talk about it from the point of view of a patient. We've talked about healthcare reform, or healthcare and the explosion of healthcare from the point of view of getting a job. But as a patient, look at the costs, healthcare costs. I don't think that most people would understand that a nice private room is going to cost you today $79,935 for a year. Go down this list here. You can see how expensive it is. Assisted living, $37,572. Andrew, I don't think we're saving enough. I don't think we're saving enough because these numbers are going up several percentage points every single year.
We talk about this with any segment that we do. Plan ahead. You have to prepare for the future, whether it's in, choosing your insurance for next year or planning what happens when you turn 65, 75, 85. Start saving today, and there are a lot of ways you can actually do that.
Talk to me a little bit about healthcare reform. In healthcare reform, there was something that you keep talking to me is so exciting. It's called the Class Act. And I have a lot about this in my book, but you can also, you can Google this as well. It was a Ted Kennedy dream provision that made it into healthcare reform.
So essentially, and I get the letters wrong, but it essentially allows employees to enroll, and you have to actually voluntarily, you're automatically enrolled and then you get opted out. But you essentially pay into this program for 5 years, and then after 5 years, if you need money for non-medical expenses...
in long-term care.
Long-term care, or any medical, any expenses associated with your health care, should you, that are not, medically oriented, you can tap into this fund up to $50 a day, and it's a great savings plan. It's controversial because it's another entitlement program. Right. It's intended to be self-funded. We'll see how it actually plays out because the rules haven't been written yet.
The issue with this is that it's going to become more and more necessary because the baby boomer generation is going to be the first one to really hang on to their youth as long as possible, and then they're going to hang on to their old age as long as possible. People are entering in, what are they, 28 months on average person is in a...
Yeah, 28 months. When you check in someplace, assisted living or to the nursing home, I mean, you're talking, most people are there a couple of years.
My grandmother has been there in one for, I think, 7 years now. She's not going anywhere anytime soon, bless her sweetheart.
And the money's coming out of her pocket.
It will be a full
every second.
Well, or my mom and my uncle and my aunt, and she's going to be there a full total maybe 11 years, and she's an outlier in her age group. in the baby boomer generation, it's not going to be, and you're going to find much bigger expense.
So the job opportunity is taking care of this aging population, but also we all need to be thinking about how we can take care of ourselves because we are that aging.
And one important point to make is we talk about health savings accounts all the time. These are, you know, tax-free accounts that you can put money into for your health care long term. You can use them for long-term care expenses. So if you put money into them, they roll over and you will be able to use it.
All right, Andrew Rubin.